Hello, everyone. Welcome to our webinar in honor of Alzheimer's Month. My name is Darryl. I'm the Executive Director of the Nassau County Medical Society and the Nassau Academy of Medicine. Before I introduce our guest speaker, please make note that everyone will be on mute throughout the presentation. At the end, you can post questions in the chat box or the Q&A box, and our speaker will answer them for you. Now to our speaker. It is our privilege to introduce Mr. Osman Canales. Mr. Canales works for the Alzheimer's Association Long Island chapter as their Outreach and Community Educator. His main role at the association is also to connect and build relations with local community organizations, faith-based groups, and leaders with the purpose of bringing support and information to those affected by Alzheimer's disease and all other dementia. Mr. Canales focuses on raising awareness about Alzheimer's disease and all other dementias, providing professional training, promoting association programs and services with the community, and delivering educational programs in English and in Spanish. Without further ado, Mr. Osman Canales.
Thank you so much, and thank you everyone for logging in for tonight's program. We're very excited to be here with all of you, and joining me is also my colleague Zuleika Ramirez. She will be also assisting me with answering some of the questions during the Q&A, and also she will be posting some of our links that we'll be mentioning to our online resources. All of our programs and services and online resources are completely free of charge, so we like to share that as well. She also will be posting a message for a link to a sign-in form. We collect these sign-in forms, which really help us to continue providing free programs to the community. Like I say, all of our programs are completely free, and that is due to grants from the New York State Department of Health, as well as other grants. And those attendants really help us to continue providing those free programs. So we really appreciate and thank you all for your support by taking some time before you log off tonight to complete that sign-in form for us. Again, thank you so much for inviting us and for having us tonight. We are excited to present. I'm going to share my screen now with the presentation, and you should be able to see the presentation on your screen. For those of you joining us via telephone, don't worry, you're not going to miss anything. We will send a copy of this presentation, and you should be receiving it within the next few days via email. So again, you will receive that the presentation on your email. I am going to turn off my camera, and this is to avoid any, to just focus on the presentation. We really want you to focus on the presentation and avoid any distractions. We also, as you know, I know you are all on muted mode, so you won't be able to, you won't be able to unmute your mics. And this way we are avoiding any background noise and any distractions. So let me turn off my camera. So this program is usually an hour long, but I know that our time is limited today. So we shorten it to 30 minutes long. And we will have some time at the end to answer any questions that you may have. Please feel free to type your questions into the Q&A feature of Zoom, and we will address them at the end of the program. Again, please type your questions into the Q&A session of Zoom. So let's start. Our program for tonight is titled 10 Warning Signs of Alzheimer's. So let's start by reviewing the objectives for this program. So today we're going to explore the most common warning signs of Alzheimer's, excuse me, to help you be informed about what is normal aging and what is not. By the end of today's program, the goal is for you to be able to describe typical age-related memory, thinking, or behavior changes, recognize common warning signs of Alzheimer's and dementia, discuss the tips for approaching someone about memory concerns, explain the importance of early detection and benefits of diagnosis, identify possible tests and assessments for the diagnostic process, and lastly, name the resources available at the Alzheimer's Association. I apologize that I have some allergies today, So I'm going to skip some of these slides. Like I mentioned, this program is an hour long, but we are going to skip some slides here to accommodate for the time that we have today. So we are here today to learn more about dementia and Alzheimer's and identify common warning signs of the disease. And you may have heard the terms dementia and Alzheimer's used interchangeably. While they are related, there are significant difference between the two. So now we're going to hear from some experts, and our first expert, Dr. Heather Snyder, will explain to us what is dementia.
Umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as we heard, right, Alzheimer's is the most common, the most common form of dementia, and there are other types of dementia. Dr. Snyder mentioned a few of them, but the list goes on. So Alzheimer's accounts for more than 80% of all dementia cases. Next, we're going to hear what is Alzheimer's disease, and Dr. Dean Harley will explain more.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Lastly, we'll hear from Ruth Drew about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So the Alzheimer's Association, excuse me, as a leader in this area, develop a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. This list is intended to be a tool to really help identify unusual changes in a person's memory, thinking, or behavior. It's important to note that this list does not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced. Individuals may experience one or more of these signs in different degrees. So now let's explore each sign and what some typical age-related changes may be. Sign number one, memory loss that disrupts daily life. One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information. Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly relying on memory aids or leaning on others for things or tasks once handled on their own. So a typical age-related change is sometimes forgetting information, but remembering later. Sign number 2, challenges in planning or solving problems. Some people may experience new difficulties in executive functioning, including developing or following a plan, or even difficulty concentrating. Conversely, a more typical age-related change is making occasional errors when managing bills or household finances. Sign number 3, difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game. Conversely, a typical age-related change will be occasionally needing help to use a microwave or the remote control. And this could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently. Sign number 4, confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time. They may have trouble understanding something if it's not currently happening, or become confused about where they are or how they got there. This can become more dramatic or profound in the middle and late stages. A more typical age-related change could be getting confused about what day it is or when a scheduled appointment is, but figure it out later. Sign number 5, trouble understanding visual images or spatial relationships. Some individuals with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distance and determining color and contrast, which can all impact driving or navigating the environment around them. So vision changes such as cataracts are a more typical age-related change. This sign shows us that these changes are not just about memory. It's very important to think about all of the other ways that someone's daily life may be impacted by any of these changes. Sign number 6, new problems with words in speaking or writing. Individuals may have trouble following or joining a conversation, stopped in the middle of a conversation and forget what they were talking about, and continuously repeat themselves. They might also struggle with finding the right word or calling things by the wrong name. They may start using more descriptive terms to talk about something rather than the name of the actual item. A normal age-related change, however, will be occasionally having trouble finding the right word, but remembering later. Sign number 7, misplacing things and losing the ability to retrace steps. And this sign often causes concern in people, and I want to clarify that this is not just about losing your keys or your cell phone on occasion, misplacing things from time to time, but retracing steps to find them. That is a normal age-related change. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen or even identify the location where it was placed. Or he or she may put things in unusual places. For example, putting shoes in the refrigerator, for example. And because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing and do so more frequently over time. Sign number 8, decrease or poor judgment. Individuals may experience changes in judgment or decision making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. And this can be especially common in individuals who live alone. So, making a bad decision once in a while, such as forgetting to get an oil change, that is a more typical age related change. Sign number 9, withdrawal from work or social activities. As we age, it's normal to feel uninterested by family or social engagement at times. However, someone who is experiencing dementia related changes may start to lose their ability to hold or follow a conversation, and as a result, begin withdrawing from social encounters or hobbies. They may lose the confidence to engage in that way. Sign number 10, changes in mood and personality. Individuals with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious. They might get easily upset either at home or when out of their comfort zone. So, as we age, however, it's normal to develop very specific ways of doing things and becoming upset when our routine is disrupted. Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that should be addressed immediately. I'm going to skip some slides here. So our next topic is early detection, and it's key that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging, as well as that of others around us. Sometimes the person exhibiting symptoms isn't really aware or may not have the insight to know that they are experiencing changes, which is why having outside perspective is critical. This is especially important for individuals who live alone or are far from family and friends. Now we're going to listen to Dr. Salloway as he discusses this, and then we'll hear from a care partner who was the first to notice changes in her husband. Let's listen first to Dr. Salloway.
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
About what was happening to Darryl, I wasn't sure. I didn't know, and this wasn't the person that I know. This wasn't the person. Darryl was my husband was very. He always had to be building or designing or working with his hands, and it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So, what should you do if you notice changes in someone And the Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive. So here is that roadmap, that 10-step roadmap, and we're going to now go step by step. And the first step is to assess the situation. And to do that, you want to ask yourself, what changes in memory, thinking, or behavior do you see? What is the person doing or not doing that's causing concern? Step 2, what else is going on? Various conditions can cause changes in memory, thinking, and behavior. Are there other health or lifestyle issues that could be contributing to these changes, such as stress, diabetes, or changes in medication? Step 3, learn about the science and the benefits of early diagnosis, and you're taking that very first step today. Step 4, you want to ask, has anyone else noticed the changes? You want to talk with family to see what, if any, changes have they noticed. And then you want to prepare to have the conversation with a person. And you want to ask, when you prepare to have the conversation, you want to ask who should be the one to discuss concerns with the person. It could be you, a trusted family member, or a friend, or a combination. And it's usually it is best to speak one-on-one so the person doesn't feel threatened or ambushed. The step 6, when and where should the conversation be held? It's important to have the conversation as soon as possible. So in addition to identifying a day and time, you should also consider where the person will feel most comfortable. Step 7, what will you or the person having the conversation say? You may want to build out somewhat of a script, and you can consider the following. You can say, I've noticed this change in you, and I'm concerned. Have you noticed this? Are you worried? How have you been feeling lately? You haven't seemed like yourself. I noticed you did this the other day, and it really worried me. Has anything else like that happened? Step 8, offer to go with the person to the doctor, or ask a relative to accompany them to see a doctor. Um, there are a lot of things that could be causing, all right, that those changes. So you want to use encouraging words like that, right? You can say, the sooner we know what's causing these problems, the sooner we can address it. Or I think it will give us both peace of mind if we talk to a doctor and we find out what's going on. Step number 9, if needed, have multiple conversations. And don't be discouraged if the first conversation is not as successful as you hoped. Write down notes about how it went so that you can prepare for any future conversations. And don't dismiss the changes you're noticing simply because the person is reluctant to address them or the conversation didn't go as planned. And the next step is to reach out for support. You can turn to the Alzheimer's Association for information and support. And I'll be giving out our 24/7 helpline number in a moment. But we have a lot of great information available at any time. And the final step is to see a doctor. And most people address concerns about memory, thinking, and behavior with their primary care physician first. However, in some cases, the primary care physician may refer the person to a specialist for further evaluation. And here are some examples of those specialists that include geriatricians who have additional training in medical care for diseases and conditions common among older adults, generally over age 65, neurologists who specialize in diseases of the brain and nervous system. There was also neuropsychologists who can assess, diagnose, and treat psychological disorders associated with brain-based conditions. Psychiatrists who specialize in disorders that affect mood or the way the mind works, and psychologists with special training in testing memory and other mental functions.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So one clarification I want to make here from what Dr. Ruth Drew mentioned is that, yes, there are treatments that treat the symptoms, but until Monday, if you probably already heard this, the FDA approved a new treatment that actually treats or delay the progression of Alzheimer's disease in some individuals. Again, that was approved on Monday. So up to Monday, there were only treatments available that treat the symptoms. But now we have that new treatment that was recently approved, and that is called Aduhelm. You might have heard this before on the news. And if you want more information, you can also go to our website. This is fairly new, so our website is being updated. There is already information on our website about this treatment. And again, this is the first treatment to treat or a treatment that actually helps delay the progression of Alzheimer's disease in some individuals. It is not for everyone, right? There has to be testing done in the individual to see if they qualify for this treatment. So I'm going to skip some slides here. I know time is almost there. Here are some possible assessments and tests. That assessment may include medical history, physical exam, screen for depression, interview with close companions, and some tests may include laboratory tests, mental cognitive status tests, and brain imaging as well. And again, not everyone will be asked to go, to have every single test listed here. It all depends on the person and what the doctor recommends. So lastly, I want to mention some of the free resources we offer at the Alzheimer's Association. So the Alzheimer's Association is available wherever and whenever you need reliable information and support. And 3 of our key resources that can connect you to information and support include our free 24/7 helpline. That's the first one, and probably one of the most important one that we have. It is a free 24/7 helpline. Individuals can call at any time, day or night, even including weekends and holidays. And dementia-trained professionals are available 24/7 to provide information, education, decision-making support, crisis assistance, and resource identification as well. Again, we have master-level clinicians available around the clock to provide in-depth care consultations, and free of charge care navigation services offered to families at any stage of the disease. Also, I want to point out that help is available in more than 200 languages through an interpretation service. So again, anyone can call our 24/7 helpline. Even if they don't speak English, they'll be able to get help in their language. The next resource is our website, and it's often the first step for individuals following a diagnosis of Alzheimer's or another dementia, and includes sessions, especially for people living with the disease, and also a session for caregivers, where they provide tips and recommendations, and a lot of great information. And our website, it's alz.org. I forgot to mention the helpline number, which is very important. That number, it's 800-272-3900. 800-272-3900. 800-272-3900. Our website, it's alz.org. alz.org. And we also have another great tool that is the Community Resource Finder. And our Community Resource Finder have a wealth of community-based resources available in your area, including long-term care and community-based services, and also local association offices, and their offering of programs and support services. Again, that is the Community Resource Finder. When the individual goes to the Community Resource Finder, they'll be able to select the service they're looking for. They'll enter their zip code, and they'll see a list of local providers with their contact information, and all the information required for their addresses for the location. So again, that is the Community Resource Finder, and that website, it's alz.org/CRF. alz.org/CRF. And our local chapter also offers free care consultations for families and individuals with a disease. And a free care consultation is a private meeting with one of our social workers where the family talk about their needs, and together find resources and create a personalized action plan with steps to follow, and also contacts to local resources as well. That is a free care consultation that we offer. And we also facilitate many support groups all throughout Long Island. Right now, due to COVID-19, our support groups are facilitated via telephone and via webinar. We have support groups for individuals with the disease, and we have support groups for caregivers and care partners as well. So I encourage you all to share this information, and encourage families to join our programs and our support groups as well, and utilize all of our services. Again, we do not ask for health insurance, and we do not send a bill home. All of our programs and services are completely free of charge. And also every week we run education programs like this one. We have education programs that are tailored to caregivers, where we provide a lot of great recommendations on how to care for someone with Alzheimer's disease or other dementias. We also host special events, for example, our caregivers conference. We also host our legal and financial planning conference with professionals and specialists that come and present on different topics. And also we provide also special events for individuals in the early stage of Alzheimer's, like a memory cafe and other social events as well. So my time is up, and I want to thank you all for listening. And now I am going to open it up for any questions that you may have.
Thank you so much, Osman, for that wonderful presentation. If you have any questions, please feel free to drop it in the chat box or in the Q&A box. We did have a couple of questions come in via email. The first question is, at what point should friends or family members seek help when a person starts exhibiting warning signs?
That's a great question. And the sooner the better, right? So as soon as you notice any of these signs in your loved one or in any individual, it could be a friend, we recommend that you have that conversation as soon as possible, because as we heard, right, an early diagnosis makes a big difference in terms of the treatment that the person can get, and especially now that this new treatment that was just approved, right, it's you know, it shows that it's for individuals in the early stage of the disease, or with MCI or MCI, right? So we see now that an early diagnosis is very, very important too. So the sooner the better. You wanna, you know, prepare to have that conversation with that person, right? Because you don't wanna come as like someone that wants to, you know, as threatening them or forcing them to do something that they don't want. And it could be something else, right? It probably is not, it's not Alzheimer's disease. It could be just diabetes or stress, you know, or something else. So you don't want to, you know, scare the person or right, or but you do want to have that conversation as soon as possible.
Absolutely. Gary Bertman would like to know, what can a person developing AD do to prepare for the coming deterioration in cognitive ability and maintain independence?
Great question. And what we recommend is that, you know, to have that conversation with their doctor, because the doctor will be the one that will provide in terms of recommendation as to which treatment is best for the individual based to their condition, right? But you always want to, you know, continue engaging, and research suggests 4 areas that we should all be focusing on, right? That's diet and nutrition, physical health and exercise, cognitive activity, and social engagement. So you want to make sure that you continue focusing on those 4 areas, right? Having a healthy diet, continuing engaging in formal education at any stage of life. So even if you are, you know, have been, or if the person has been diagnosed with a disease, you still want to continue engaging and just follow the recommendations that your doctor has set for you.
Absolutely. Thank you. Another question that we received via email says, while Alzheimer's primarily affects those 65 and older, does the disease affect those who are younger? And how do the symptoms differ, if at all?
Yeah, that's another great question. And the answer is yes, individuals under the age of 65 can get Alzheimer's disease as well. And that the name for the disease is younger onset Alzheimer's. Again, that's younger onset Alzheimer's. So individuals, according to reports, individuals could get the disease in their 40s or 50s. And we do have, you know, constituents. We call them constituents, or you may call them patients. We have constituents that have the disease and they're under the age of 65. So yes, individuals under the age of 65 could develop Alzheimer's disease. In terms of the symptoms for the disease, right? It all depends on the individual. We always say that if you met someone with Alzheimer's disease, you just met one person, because every person is unique. Every person is different. Some individuals may experience, you know, the symptoms one day, and then the next day they could be functioning just fine, right? So, or they may exhibit some symptoms that other individual may exhibit other different symptoms. So again, every individual is different.
Absolutely. Thank you. Another question that we got is, what role does alcohol and drug consumption play in Alzheimer's disease and other forms of dementia?
Yeah, so there is no yet, there is no research that shows a connection between drinking alcohol, could lead to dementia. We do know that excessive drinking of alcohol could affect memory, and it could affect memory, it could affect balance, right, concentration. But there is yet, there is no research, or there is no connection between drinking alcohol that could lead to Alzheimer's. But definitely, we recommend, right, individuals that if they haven't started drinking yet, that they don't start, because there are some negative effects, like it could also interact negatively with medications. So you really want to be careful, right? If you're taking medications, you shouldn't be drinking.
Absolutely. Are there any further questions? Yes. Okay. So another question is, how does a diagnosis of AD affect the insurability of an individual? Driver's license, employment, eligible for disability benefits?
Yeah, that's great questions. And we, have seen individuals that are professionals, and they have their, their jobs, and then they are diagnosed with Alzheimer's disease or other dementia, and the impact that this creates in an individual. It's definitely something that nobody is waiting for, right? A diagnosis like this. It will take time. So what we say is that it will take time to accept the diagnosis, right? You do want to have that honest conversation with your loved one. If you're a caregiver, a relative, you do want to have that honest conversation with them as to what the disease is, and also learn more about the disease, how it progresses, and how it impacts the individual, right? And what can you do to be able to live well? Because we know, right, with support and the all the support that we offer at the Alzheimer's Association, it could really help an individual live well, right? Yes, there is no cure for Alzheimer's disease, and this new treatment also does not cure Alzheimer's disease, right? But we, as the Alzheimer's Association, are moving forward in research also to hopefully soon find a cure for the disease. So yes, it will affect the individual in terms of employment, and we do recommend, the individual to have that conversation, as the sooner the better with their employers, because there could be some other employment benefits that they could qualify for. So it's important that they are not afraid to speak speak with their employer, with human resources, about what benefits do they have there that they could apply for. And also, disability benefits could be another possibility as well. And we know that this disease also does take a financial toll in the individual and the family. So we always recommend the individual to ask family for help, to ask family for help, and also eventually they will need care as well, right? So you have to prepare in advance. So definitely, we recommend the individual and the family to prepare in advance, and to learn as much information as possible. We do provide our legal and financial planning program that is facilitated by one of our attorneys, our volunteer attorneys, and they provide a lot of great information as to what an individual can do and what benefits are available that they may qualify for. So it's strongly, recommend also participating in that legal and financial planning program that we offer.
Absolutely. Thank you. Are there any other questions? Okay. All right, with no further questions, I just want to say thank you, Osman and Zulika, for joining us tonight and for this very important webinar. This recording will be available on YouTube tomorrow, And thank you to everyone who joined us. Thank you so much and have a good night.